Welcome back to our channel. Today, we're diving into a crucial topic that everyone should be aware of. The signs of HIV in adult females. We're going to cover 15 signs that might indicate an issue. Now, don't freak out and start self-diagnosing. Remember, a lot of these symptoms can be caused by other common illnesses. That's why it's so important to see a doctor for an accurate diagnosis. Early detection can make a huge difference. So stay tuned to learn more. So why is it so important to recognize the early signs of HIV? Well, like many conditions, early diagnosis and treatment is key. When we catch HIV early, we can start antiretroviral therapy, or ART, sooner. ART is a lifesaver, literally. It helps keep the virus under control, prevents it from damaging the immune system, and significantly reduces the risk of transmitting HIV to others. Early detection isn't just about starting treatment. It's about empowering you with knowledge and control over your health. It's about understanding your body and advocating for yourself. So let's talk about some of the things to look out for. Remember, experiencing one or two of these symptoms doesn't necessarily mean you have HIV. But if you're experiencing multiple symptoms, especially if you have any reason to believe you might have been exposed to HIV, it's crucial to see your doctor for testing. One of the tricky things about HIV is that the early symptoms can often mimic those of other common illnesses like the flu. You might experience fever, chills, sore throat, muscle aches, headaches, all those things that make you want to curl up in bed with a big bowl of soup. The difference is, with the flu, these symptoms usually subside within a week or two. But with HIV, these flu-like symptoms can linger for weeks or even months, leaving you feeling drained and run down. So if you're experiencing persistent flu-like symptoms that just won't quit, it's worth getting checked out by your healthcare provider. Let's talk about fatigue. And I don't mean I need an extra shot of espresso kind of tired. I'm talking about that deep, persistent fatigue that makes even the simplest tasks feel impossible. Everyone gets tired from time to time, but if you're constantly feeling exhausted even after a good night's sleep, it could be a sign of something more serious, including HIV. HIV can attack the body's immune system, and when your body is constantly fighting off infection, it can leave you feeling completely drained. So if fatigue is interfering with your daily life and you can't seem to shake it, don't ignore it. Talk to your doctor. Unexplained weight loss is another red flag. I'm not talking about intentionally shedding a few pounds for summer. I'm talking about losing a significant amount of weight without even trying. If you're noticing your clothes are fitting looser, you're losing your appetite, or the numbers on the scale are steadily dropping for no apparent reason, it's time to see your doctor. HIV can interfere with your body's ability to absorb nutrients properly, leading to weight loss. It's important to get to the root of the issue and make sure you're getting the nutrients your body needs. Lymph nodes are small, bean-shaped glands that are part of your immune system. They help fight off infections by filtering out harmful substances. When you have an infection, your lymph nodes can become swollen and tender. Now, swollen lymph nodes are a common symptom of many illnesses, from the common cold to more serious infections. But if you have swollen lymph nodes, especially in your neck, armpits or groin, and you can't figure out why, it's worth getting checked out. HIV can cause persistent swelling in the lymph nodes, so it's always best to err on the side of caution and get it checked out. Skin rashes and sores can be another sign of HIV. These rashes can appear anywhere on the body and can vary in appearance. They might be red, brown, pink or purplish, and they might be itchy, painful or raise bumps. HIV weakens the immune system, making it harder for your body to fight off infections. This can make you more susceptible to skin infections, which can cause rashes and sores. If you notice any unusual skin changes, especially if they don't heal quickly, it's important to see a dermatologist or your primary care physician. As I mentioned earlier, HIV weakens the immune system, making it harder for your body to fight off infections. This means that people with HIV are more likely to get infections, and they might experience more frequent or severe infections than someone without HIV. These infections can range from common colds and flus to more serious infections like pneumonia or tuberculosis. If you find yourself getting sick more often than usual, or if you're having trouble shaking off infections, it's important to talk to your doctor. Night sweats are exactly what they sound like. Excessive sweating during the night. I'm not talking about waking up feeling a little warm after a vivid dream. I'm talking about soaking through your pajamas and sheets, even if your room is cool. Night sweats can be caused by a variety of factors, including hormonal changes, certain medications, and infections. But they can also be a sign of HIV, especially in the early stages. If you're experiencing drenching night sweats that are disrupting your sleep, don't just brush it off. Talk to your doctor. Muscle and joint pain can be another sign of HIV. These aches and pains can range from mild to severe, and they can affect any part of the body. HIV can cause inflammation in the muscles and joints, leading to pain and stiffness. It can also damage the nerves, resulting in pain, tingling, or numbness. If you're experiencing persistent muscle or joint pain that you can't explain, don't just reach for the pain relievers. Talk to your doctor to rule out any underlying conditions. HIV can also affect a woman's menstrual cycle. Some women with HIV experience lighter periods or miss periods altogether. Others might have heavier periods or more cramping than usual. These changes in the menstrual cycle can be caused by a number of factors, including stress, weight loss, and certain medications. But they can also be a sign of HIV. If you notice any significant or persistent changes in your menstrual cycle, it's important to talk to your gynecologist. Yeast infections are caused by an overgrowth of fungus in the vagina. They're a common problem for women, but they can be more frequent or severe in women with HIV. Remember, HIV weakens the immune system, making it harder for the body to fight off infections, including yeast infections. If you're experiencing frequent yeast infections or if they're not responding to over-the-counter treatments, it's important to see your doctor. Pelvic inflammatory disease, or PID, is an infection of the female reproductive organs. It's often caused by sexually transmitted infections, and it can be more serious in women with HIV. PID can cause a range of symptoms, including pelvic pain, fever, abnormal vaginal discharge, and pain during sex. If left untreated, PID can lead to infertility. If you're experiencing any symptoms of PID, it's crucial to see your doctor right away. HIV can also affect the nervous system, leading to a range of neurological symptoms. These symptoms can include memory problems, difficulty concentrating, headaches, vision changes, and numbness or tingling in the hands and feet. In the later stages of HIV, the virus can cause more serious neurological problems, such as dementia. If you're experiencing any unexplained neurological symptoms, it's important to see your doctor to rule out any underlying conditions. Shortness of breath can be a symptom of a variety of conditions, from asthma to heart problems. But it can also be a sign of HIV, especially if it's accompanied by other symptoms like a persistent cough or chest pain. HIV can weaken the immune system, making it harder for the body to fight off lung infections. It can also damage the lungs directly. If you're experiencing shortness of breath, especially if it's new or worsening, it's important to see your doctor to get checked out. We've covered a lot of ground today, but the most important thing to remember is this: the best way to protect yourself from HIV is to get tested regularly. Knowing your status is power. It allows you to make informed decisions about your health and take steps to protect yourself and your partners. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once in their lifetime. People at higher risk of HIV should get tested more often. Getting tested is easy, confidential, and often free. You can get tested at your doctor's office, a local health clinic, or even some pharmacies. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe. Stay informed and take care of your health. Remember, knowledge is power. The more you know about HIV and how it affects women, the better equipped you'll be to protect yourself and your loved ones. If you have any questions or concerns, please don't hesitate to reach out to your healthcare provider.